Sandra. It's nice to meet you. You're Rose's mom, right? Awesome. So, what we're going to work on today is working on getting home. So, Rose is now using her power wheelchair, which is doing great, right?
Yes.
Awesome. So, what I want to treat you today is how to get Rose out of bed and eventually work on getting her into the wheelchair and into the wheelchair to the bathroom and things like that. But first, I have to teach you how to get her out of bed. So Rose, we've been doing that a lot during the day, right?
Yeah.
Good. So we have to do that every time you go to therapy, every time you go to the bathroom. So it's a big part of your day. And as her caregiver, Sandra, we don't want to cause any injury to you or have you injure yourself while doing these transfers. So that's why we're going to teach you different techniques to work on and to use while you're transferring to prevent injuring you or Rose. So I have this handout that I'm going to give you a paper copy of, and basically it has some tips that I want you to take into consideration when you are doing any transfer whatsoever, not just this bed mobility with Rose. So some basic tips are to keep Rose close to your body. Her body and your body should be very close together. If you guys are far away and you have her from a far distance, that's causing it to be harder for you because now you have to go against all this distance. So keeping her close to your body is going to make it a lot easier for you. When we're doing pivot transfers later on, that you're going to make sure you keep your knees bent to prevent strain on your back so that you're using legs more than using your back. That's how you're going to prevent injury there. Keeping your back straight, you're not going to want to hunch over, you're not going to want to hunch, twist, do stuff like that. That's straining your back even more. We don't want that. We want to keep an upright back, knees bent at all times. With that is keeping a wide base of support. So you don't want your legs here. You don't want them all the way out here because then you don't have much room. You want them kind of a little past your shoulders maybe. And feeling that you're sturdy, holding her here. If you have here, you're close together, then you won't be, you're more susceptible to fall, lose balance, and we don't want that. And then the last tip is to avoid combining movements. So you're not gonna just one swoosh, put her over. You're gonna lift, then turn type deal. We're not gonna be combining those types of movements because that leads to more injury risk. So all those are things you should be taking into consideration when we're doing these techniques with Rose. But first, we're gonna do a little bit of bed mobility, and it's a log roll technique. So Rose, because we're having difficulty with sensation on this side, what we have to do is protect her right side because she isn't able to feel it all the way. Right, Rose?
Yeah.
Okay. So in order to do that, can I grab your arm?
Yeah, go for it.
Okay. What we do is we're going to grab the arm and we're going to move the shoulder forward before we're lifting to prevent rolling onto the shoulder. So I'm going to have you cross this arm right here as if you're going to hold yourself. Perfect. And then we're going to turn this way. So Rose, I'm going to have you bend this knee and then you're going to cross it this way like we've done. Awesome. And then I'm going to put this hand on her hip and we're going to roll. 1, 2. Good. So see how her shoulder's forward, you're not rolling onto that shoulder, possibly injuring it. That's how we do that. Now we're going to work on the sitting up motion. So here, I'm going to have this arm under the right shoulder and this hand on her hip. So in one fell swoop, we're going to have her move her left leg down, and that's going to move her right leg as well. Ready, Rose? 1, 2, 3. Good. So now she's on the edge of bed, and then we can adjust. So we're going to move this right leg to the right, and then there you go. You can move that one. Awesome. And see how our arm is protected here? It's not all the way in the back or something like that. Again, making sure we keep her right side intact and without injury. And so from here, we can move on to later doing other transfers to the wheelchair to the bathroom, but it's the same kind of deal. And it's the same scenario when we're laying her back down. She would go here, we would turn her to the side, and then we would go to laying on her back. Any questions?
Not for me.
No?